guys, welcome back to my channel, and if you're new here, my name is Sarah with Simply Miss Sarah. And I haven't done a jaw surgery video in a while, and if you don't know, I had a BSSO, which stands for bilateral sagittal split osteotomy, in March, so it's coming up on a year, and I will do a year update with how my jaw surgery's been going. But I wanted to do a video today on some of the items that I have come across in my minimalism journey that I used during my jaw surgery, and I have compiled a list of things that were absolutely necessary during surgery for me, and that will be coming up next. So let's get into the list. So the first item on my list of things that were necessary for me during or after surgery is a shirt that buttons in the front. Now this is not the one that I wore for surgery. I actually, if you go back into my videos, you'll see I had like a green and gray plaid shirt on, but it's a button down just like this, long sleeve. And this was so essential because after I got out of surgery, I did not want to be in a hospital gown. And I had an IV, and my IV was running a lot for my pain medication, antibiotics, things like that, and fluids. So I was able to put on a shirt that was like buttons down in the front, and because it buttoned down, you're able to like unbutton it, and then you can put your arm through, and that way if they need to like get to your chest or if they need to get to your IV, it's a lot easier for the nurses. And had I not had a button down shirt, most likely I wouldn't have been able to change out of the hospital gown. Also, with you having just had surgery, your face is very swollen. I had a big wrap on my head. It's called a Jopes wrap. It helps with inflammation. And I wouldn't have been able to pull the shirt over my head, so this way I was able to just put my arms in and button it up the front. This one I got at Goodwill, and like I said, I didn't actually have this one during surgery. The one I wore was actually a gift. But Goodwill's a great place to find things. I actually really like this shirt and wear it all the time. But you could find a shirt that maybe you don't care about if it gets drooled on, it gets blood on it. You might already have something at home that you could just use. But item number one that you need before you go to surgery is a button-down shirt. So item number two is this wedge pillow. It's made for a bed. And I got this off of Amazon, and I'll put a link below. So this is like the description. And how it works is so it comes in like this square form, and you could use it like this to sit up against, but it also folds out like this into a wedge, which is why it's called a wedge pillow. And you sit it like on the couch, and then you can pile pillows on here, or you can just put a pillow up here. I really like this. You could just pile up pillows, but I didn't have that many pillows, and I was sleeping on the couch. So this was nice, and with this, instead of having to like pile the pillows up against the back of the couch, you're able to put them on here, and I was able to like lay down more but still be propped up, as opposed to on the pillows I felt like you have to kind of lean against the back of the couch to maintain that propped up angle. You could also sleep in like a recliner if you have one of those. I wasn't that comfortable in the recliner. So this actually worked out really well for me. And this transitioned well to the bed because you actually have to lay propped up in bed for a while too. So instead of like if you were in the recliner and then you move to the bed and maybe you don't have enough pillows, this was something that transitioned well from the couch to the bed. The other nice thing about the wedge pillow is that if you have another surgery, maybe not necessarily like on your face, but like if you broke your leg or your arm or something like that, this can be used to prop up like a limb. So if you had like a leg, you could put this like down here and put your leg onto it to help elevate. We actually use things like this in the hospital for orthopedic patients. Ours are yellow and they don't fold into a square. They're just like a foam wedge. But yeah, this is something that you could let people borrow. I actually have offered this to people who had surgery, and yeah, they could borrow it, you could give it away, but it's something I've kept because from now until the end of time, if I have kids, if me or my husband end up needing something for some kind of surgery or injury, this is something that could come in handy, and it really wasn't that expensive. The third item that was absolutely a lifesaver after I had surgery were ice packs. And I would keep a minimum of 3 to rotate through so that you can have one on and then 2 in the freezer. One will have just gone back in. I guess you could get away with 2, but I liked having 3 in case maybe I grabbed one and was not feeling well enough, like I forgot the one that I had with me. That way you kind of have 3 in rotation. Of the ones I had, this was my favorite one, and it's called a peas pack. And you can use it warm or cold. I always used it cold for inflammation and pain. My mother-in-law, this is actually my mother-in-law's, thanks Beth, I have to get this back to you. But it's like, got these like beads in it. And so that way it kind of like conforms to your jaw, like this. You can kind of like curve it. And it comes with this little cover for it. So that, I didn't always use a towel around it because it has this cover. That was sometimes enough. And I really liked this one. So I'll link this one in the description as well. But this is essential. I'd wake up, my face would be swollen from laying down all night. My jaw would be sore. I used this for up to 6 weeks. So these are essential. They do give you some when you get home from the hospital. If you saw my vlog of my jaw surgery, you'll see I had like the sling one that ties up on top of your head. You can use that, but by the time it's been a few weeks, it's a little excessive to need that all on your face. Sometimes I would just do like one side and lay on it, and then I'd do the other side and lay on it. That big sling one is a little cumbersome if you're trying to sleep and lay down with it and you're not going to just lay flat on your back. Item number 4 is Aquaphor, and this is actually the tube that I had when I had surgery. I was recommended to this from some other videos I had watched because people say their lips get really dry. And my lips are dry all the time. I didn't notice that they were really any more dry during or after the time that I had surgery. But this, for chapped lips, is the best. It's better than any chapstick I've used or anything else. So maybe just like Life Pack, Aquaphor for your chapped lips. Maybe your lips will be drier than mine were during surgery, and if so, this is the best stuff. I recommend it highly. And it can be used for other dry skin too, so a lot of times I'll just take this, put it on my lips, and any extra I'll just rub on the back of my hands. And even at work when I am using sanitizer like every 5 seconds and I'm washing regularly, my hands never really get dry, and maybe it's because of this Aquaphor. Item number 5 is my Magic Bullet. And this was actually gifted to us, and we had this before my surgery. And we actually have a normal size blender too. We have a Ninja. But this, because it's easy to clean and we have multiple cups like this to go onto the blade. So you can just take this off, drink out of this. It's easy to wash, and it's just really low maintenance, which after surgery, because you're not going to be feeling good, and when you end up being home alone by yourself, this is top notch to use. And I blended a lot of food in this. If you watched my vlog, you saw me try and put, I think it was black bean soup and bread and butter and milk in this. That didn't work out that well, that specific mixture, because it was kind of chunky and didn't go through my straw. But for smoothies and other items that I wanted to blend, this was awesome. I used this, one of my favorite foods when I had jaw surgery and I was getting really tired of like tomato soup and juice, is I ended up going to Panera and I would get their broccoli cheddar soup, which is like top on my list of soups. It's like my favorite one. But it's got those broccoli chunks, and if they forgot to blend it for me, if I forgot to ask for it blended, I could put it in this and it would emulsify it, and it was perfect to go through my syringe straw concoction thing. So there's also a NutriBullet. You could use a NutriBullet too. From what I know, it's like the exact same concept. We just happen to have the Magic Bullet. But I'll link both below so that you could check these out. These are awesome. Item number 6 that I have not seen anyone else really recommend but ended up being amazing for me after jaw surgery are these little tiny baby spoons. And I ended up using these because after they unbanded me when I still had my splint in, so my splint was wired into my gums and it would not come out if you haven't watched my video. When they loosened the band so I could like move my jaw out of it, but it was still up there, I could not fit a normal size spoon into my mouth, and I also couldn't use a straw because between my braces and the splint, it was so bulky I couldn't like close my lips around it to use a straw, so that was not helpful at all. I could drink out of a cup, which was great after I got my bands loosened, but as for things like pudding, jello, eggs, like scrambled eggs, I couldn't use a straw. I couldn't just drink it. So these little spoons were amazing. They were just like perfectly flat enough that I could fit them into my mouth. And the other thing that worked, if it wasn't super liquidy, was a fork. And the fork fit in fine because it's flat. But for anything, like I said, like jello, pudding, things that I couldn't use a fork necessarily, and I couldn't use a normal size spoon, these were top notch. I'll link something similar to this below if you want to look into this for jaw surgery. I don't know if you'll have a splint that you have to keep in, but if you do, maybe that's something you could ask your doctor. These are necessary. Last item on my list, number 7, is a baby toothbrush. And I'm sure you have a normal size toothbrush at home, but the problem is if you have a splint like I did, and when you open your mouth, like your jaw, you can only open so much, and my normal size toothbrush would not fit like into that space. So I used this little toothbrush to get into the groove of my splint under my teeth, and then I also could get it into my mouth and like brush my tongue and like the back of my splint. And I only have one. I only ever needed one, so you could just buy one. I'll put a link for something similar to this. This is a Colgate. This worked perfectly. You could get this at a local store, but I'll also link it in case you just want to get everything on Amazon. And like I said, this again was necessary. When I had my rubber bands loosened and my splint was still in there, the smell was so disgusting. Again, if you go back and watch my original video, which I will tag up above, it was so nasty, the smell. So this, again, you can't use it with toothpaste because it will possibly dissolve your stitches. You have to use the chlorhexidine mouthwash that they give you, but you can still brush. And using the toothbrush helped at least to kind of keep it clean enough to keep that smell at bay, because that smell was unbearable. You have to get in there with something if you're going to make it through 6 weeks with that splint, because like I said, I don't think for any of the time while I had that splint in I could fit in a normal toothbrush. So right here, number 7, important. It will get you through the stink and the nasty baby toothbrush. The last item that I want to talk about that I bought and I didn't end up using, I have it somewhere in my things to get rid of. I cannot find it, but if you can picture like the old-fashioned ketchup and mustard bottles, like they're long, plastic, squeezable, pliable tubes with the cap on top that has the nozzle. I bought some mini ones. They were like this tall with clear plastic, and I thought they were kind of like wide mouth, so they'd be easy to clean and to pour stuff into. And my doctor, my NP at my surgeon's office, they all recommended these to me. And the problem is that before, like when I had my splint in and my bands were on, there was no place for me to put the nozzle into because the splint covered both, like where my teeth touch, so I wasn't getting it in there. I had to use the red straw thingy with the syringe to go all the way in the back of my mouth, so I couldn't use it then. And then when they loosened my bands, and then like I could open my mouth a small amount, that's when I started using these baby spoons and for like mashed potatoes, pudding, things like that. And then I could drink out of a cup. So then there was no need for these. It was going to be more work to use them than like benefit. So I would not, if you're going to have a splint like I had and you're going to be shut and then you're just going to be opened, they were useless to me. Now maybe with people that they don't have the splint or they don't have to keep it in as long, or they can open their, I don't know at what point they would have been useful, because I thought they were going to be great until I realized I had this splint and that was covering where my teeth opened. So it was useless. I would not recommend them. They weren't expensive, but at the same time, if you don't need them, you don't need them. So that's my list of things that you need if you're going to have a mandibular advancement or a BSSO with a splint. If you have any questions for me, feel free to leave them in the comments. I would love to answer them for you. And you can also follow me on Instagram at Simply Miss Sarah. And I hope that this was helpful for you. And if you like this video, please give it a thumbs up. And if you'd like to see more videos like this, please subscribe to my channel. Thanks everyone. Have a great day. Bye.